Good afternoon, everyone. It's Dr. David Johnson here, talking to you from our office at St Andrew's Hospital. Of course, I'm sure everyone understands that it's a very sobering period of our lives right now, and it goes without saying that I sincerely hope everyone is coping in all aspects of their lives. I'm sure it's impacting on everybody in some form or another. And of course, some people will be most severely impacted by the health and economic crisis that's going on. I just wanted to update you on what we're doing at City to Coast Neurosurgery and the Back Pain Centre and the Functional Movement Training Centre. Obviously, we have been implementing social distancing, and we have actually been doing this for the better part of 4 weeks now. Since the beginning of March, we've had no greetings or handshaking going on between myself and patients. And 2 weeks ago, we stopped doing live consultations. So these chairs that you see here have been empty for 2 weeks, but I have been conducting video consultations for 2 weeks now. We have extensive experience with video consultations, so don't be daunted by the fact that a consultation talking about your neurosurgical or spine surgical issues is being done through teleconferencing. It's extremely effective, and also you will have already likely had a clinical examination from your general practitioner. And my staff are very experienced at seamlessly helping you with downloading necessary software so that the hassle factor is minimised. What I've found is that many patients are actually really appreciative of the increased convenience associated with teleconferencing and being able to do the consultation over a similar time frame of 30 to 45 minutes from your own home or from your office. I've done teleconsultations with patients sitting in their motorcar on the side of the road. And also I've done hundreds of consultations when the patient is sitting next to their general practitioner, but that is not an absolute requirement. If a patient requires a live consultation, a conventional consultation with me, because I do need to perform a clinical examination or go through things in a little bit more detail, then of course in those circumstances that will be arranged. So we're still full steam ahead in terms of assisting patients with clinical assessment of their condition, and we realise that this crisis, this COVID-19 crisis, does not need to interfere with your medical assessment and obtaining a diagnosis for the symptoms that are really impacting on your life as well. In terms of actually treating you, medications can be coordinated with your GP, and the communication that I have back with your GP. We can fax prescriptions to your preferred pharmacist so that they can be dispensed appropriately. In terms of surgery, I'm sure most of you have heard that only Category 1 or urgent Category 2 cases can be performed, and so In general, that means that surgery that should be performed within a clinical time frame of 30 days or up to 90 days for Category 2, 30 days for Category 1, and that's regarding elective surgery. So elective Category 1, elective urgent Category 2. That does not include emergency surgery, which is really considered immediate surgery or expeditious surgery upon presentation. Most neurosurgical interventions that I perform are involving some form of neural compression, be it the spinal cord or the nerve root or the brain. So as a general rule, most neurosurgical conditions that need surgery or where surgery can be considered are going to fall into that Cat 1 or urgent Category 2 definition. The cases that don't fall into that definition are really long-standing pain issues, long-standing joint-related pain or dysfunction, such as fusions for back pain or fusions for sacroiliac joint dysfunction, fusions for neck pain, and they are fairly infrequent. Okay, they're fairly infrequent surgeries that I engage in anyway. As you'll probably be aware, a large part of my practice is back pain and neck pain, and we are the only practice that delivers functional movement therapy. And functional movement therapy to assist with patients' chronic disabling pain is regarded as an essential service. The unique thing about functional movement focused rehabilitation is that it is a no-touch technique methodology. It's a skill acquisition training program. So we can still deliver functional movement therapy or the NeuroHab program either via teleconferencing, as long as the movement therapist can see you moving and that they can hear and communicate with you, so that we can provide you with those verbal and visual cues to correct your movement and modify the way that you're moving your body. Then it can still be extremely effective. So that option is still available for managing your spine-related pain, neck pain and back pain most predominantly. So that treatment option is still there. We also have a very large facility in Brisbane that is still delivering in-house functional movement therapy. It's about 400 square metres, and we're offering that service to patients, 5 patients at a time. So you can imagine that the actual space that every single patient has is huge, over and above the recommended guidelines of 4 square metres. In fact, it would probably be in the order of 10 to 15 square metres per patient. And again, the movement therapist in that setting is not it does not need to touch your body, is nowhere near your body, so safety for both our therapists and yourself is maintained above and beyond the guidelines. If you think about people that are still going and having haircuts and things like that. But that's another factor. We don't need to compare ourselves to what other people are doing. I'm confident that when we deliver this essential service to help people's pain symptoms, it can be delivered very safely. Of course, all of those other recommendations or necessities are employed. If anyone was feeling unwell, they're not to attend, of course. Very, very strict hand hygiene, very, very strict equipment hygiene. So every part of the functional movement training centre studio is cleaned in between patients attending, and really there are no couches in functional movement therapy. It's all about you standing up, sitting down on a chair, moving your body through positions of daily living, and engaging in those movement tasks as proficiently and optimally as you can, and progressively getting better with those movement tasks and implementing them into your daily life. And that's really the secret to reducing those joint-related back pain, spine pain, neck pain issues that afflict so many people. So that's just a very quick summary of how our practice is managing things right now. We are an essential service. I've also volunteered my services in the public hospital, so if at any point those more acute services are required, then I will stop my private practice and assist where I can in the public sector. And hopefully that won't be required, but of course we will keep all of our patients and our general practitioners up to date with news on that front. So that's all the best, and please stay safe, and let's get on with eliminating this despicable imposition on our wonderful lives. Talk to you next time, guys.